Ever wondered how endodontists manage to delve into the deepest corners of your tooth without causing any harm? The answer lies in a simple yet effective procedure known as a test cavity. In the realm of endodontics, a test cavity is a crucial tool in the diagnostic arsenal. It's a technique used to determine the vitality of a tooth, and today we'll walk through the process step by step. Firstly, it's important to understand that a test cavity is generally considered when other vitality tests don't provide conclusive results. The goal is to expose the pulp, the innermost part of the tooth, to assess its health. The procedure begins with the application of local anesthesia to numb the area. This ensures that the process remains comfortable for the patient throughout. Once the area is numb, the endodontist selects a suitable tooth for the cavity. The tooth in question is often one that is suspected of having a non-vital or diseased pulp. The endodontist then starts drilling a small hole or cavity into the tooth using a dental drill. The cavity is made just deep enough to reach the dentin, a layer beneath the enamel. This is a critical point in the process. If the patient feels any sensation, it indicates that the pulp is still vital and the tooth is healthy. However, if there's no sensation, it could mean the pulp is non-vital. Remember, the aim is not to reach the pulp, but to get close enough to test its vitality. If the pulp is inadvertently exposed, it may need to be treated, or the tooth may require a root canal treatment. After the procedure, the cavity is filled with a temporary filling material. The patient is then scheduled for a follow-up appointment to assess the results and plan further treatment if necessary. To summarize, a test cavity in endodontics is a diagnostic tool used when other vitality tests are inconclusive. It involves drilling a small hole in the tooth to the level of the dentin to test the pulp's vitality. The patient's response to sensation is crucial in determining the health of the pulp. Remember, the goal is not to expose the pulp, but to get close enough to test its vitality. A test cavity is filled temporarily after the procedure, and a follow-up appointment is scheduled to plan further treatment if required. Appreciate the precision and care that goes into the field of endodontics. Each procedure, including the test cavity, is meticulously designed to ensure your oral health is never compromised. Thank you for tuning in to Mind Musings.